They use behavioral health approach to treating chronic pain, which is getting results. Here with more is Dr. Peper from the Pain Center of Arizona. Yes, you're Dr. Pepper, but you're not sugary. This stuff is, something to help people with pain. But how did you get involved with the Pain Center of Arizona? Because you're a psychologist.
Well, it's quite interesting. Dr. Sywick, who is the medical director at the Pain Center of Arizona, several years ago after he opened his first clinic, the Pain Center of Arizona Clinic, contacted me because we had a mutual interest in providing a behavioral health component to the actual treatment of pain management. Traditionally, it's been more medically oriented, so providing a behavioral health component to address the mind part. Pain, traditionally most people think of it as a body issue, which of course it is, but having the mind component, behavioral health focuses on the emotional distress that comes with pain. It's natural and it's normal, but it's very difficult to deal with.
What is your approach to helping people with pain then from the behavioral standpoint?
Well, to go back to your comment about being a psychologist, a lot of people think, with psychologists we treat more of the traditional broadly based approach, in relationships with others. It does.
Why do I hate myself? That kind of thing.
Those sorts of things. So what I do is I provide a behavioral health treatment that incorporates the pain-related emotional distress, very much focused on the health and the psychological aspects of having pain in your body.
You know what? When my mom had a stroke, I always noticed that she had a lot of stress on her because she didn't want to help a lot of people, ask a lot of people for help because she has that train. Is guilt part of it when they have to have somebody taking care of them?
I'm glad you said that because there is such a mixture of complicated and really oftentimes intense emotions that comes with dealing with chronic pain. I like to tell my patients, chronic pain is invisible, but the emotional aspect of it and the struggle that people have is sometimes even more invisible.
Yeah, a lot of people tell you, they think you're joking or they think you're a complainer when you really have chronic pain, and they don't understand it.
Absolutely. And the other piece that I think is important that you just brought up is the variability.
How does a behavioral component help people in the pain treatment process at your clinics?
The behavioral component allows them an opportunity to really express the emotions that they feel. Chronic pain separates people from their families. It severs relationships at times, and it robs people of their identity. They may have thought, well, I'm going to be the mom that can play with my children. They can't bend over to pick up their children. So we talk about coping strategies that they can utilize to deal with the natural, normal parts of life and still have a quality of life that they can provide for themselves as a mother, as a wife, as a daughter, all those roles that they have in their lives.
What are the other resources out there for people who are struggling with pain in their lives?
Well, we have the physicians at the Pain Center of Arizona who provide the medical treatment, and we also have, I think it's great, we've got the Pain Center Pain Channel. And the most recent episode is actually an episode that I was involved in, and what it does is it provides on the internet information for people who have an interest in learning more about specific disorders or syndromes or diagnoses that they have related to chronic pain, as well as my part, which is the emotional aspect of chronic pain.
It's good that it's out there because that gives people an idea of what they can expect and that they're not alone in their struggle.
Yes.
We have a clip from the show where people can taste, so let's take a look.
Okay.
Has given me some tools that help me be a better mom, because she helps me not be so hard on myself.
It's more the two of us standing shoulder to shoulder and really coming at this chronic pain.
I mean, she gives me little post-it notes at the end of our sessions, and I have them, in my wallet, so that I will constantly be reminded of the little things that she's giving me, little tidbits, little pearls of wisdom.
Their quality of life and their level of satisfaction within themselves and within their world has improved. That's something.
I like what you said, that quality of life and their level of satisfaction. That's something people probably don't think about when they're going through, or when somebody they know is going through pain.
Yeah, the quality of life is something, again, as I said earlier, there's an invisible component to chronic pain. They tend to be, not overtly, but people inadvertently may judge them. Well, yesterday you were able to do something such as, for example, pick up your child. Well, they have a flare-up in pain, the next day they are unable to pick up their children. And that's difficult. How do you explain that? And when you're in high level of pain, you don't tend to be able to talk so much. I mean, you want to kind of isolate yourself and kind of deal with your pain on your own.
Well, thank you so much. Thanks for
Thank
telling us
you.
about that. That's really neat that you guys are doing that on the web so other people can find out what's going on maybe with them as well, and they can seek help. If you would like more information on the Pain Center of Arizona and the Pain Channel, you can go to painchanneltv.com. There you see it right there on your screen. Or you could check out thepaincenter.com or call the number you see right there on your screen. Oh, it's painchannel.tv. Again, that's painchannel.tv, or for their website, it's thepaincenter.com, or check the number you see right there on your screen.